Hello guys, welcome to Fortune Healthcare channel. Today I'll be talking about RHESUS incompatibility and how it can affect your pregnancy. So if you want to know how RHESUS incompatibility can affect your pregnancy, please keep on watching, watch this video to the end, and please do not forget to hit the subscribe button on your notification bell so you'll be notified whenever I upload videos like this. And please like, share and comment in the comment section. If you have any question, just drop a comment and I promise you I'm going to reply every comment. Thank you. I tell you how RHESUS factor or RHESUS incompatibility can affect your pregnancy, I want to tell you what RHESUS factor is all about. So RHESUS factor is an inherited protein found on the surface of your red blood cell. So have you gone to the hospital for your blood group test and the result comes out and you find out that your blood group comes with either a positive or negative sign? Yeah, so if you are RHESUS factor positive, that means your blood group has the D antigen, which are inherited proteins. So if you are negative, that means the D antigen is not found on your red blood cells, like on the surface of your red blood cells. I want to tell you about antigens and antibodies. I want to talk about these antigens and antibodies because in the middle or at the end of this video, I'm going to be talking about how antigens and antibodies play a major role in RHESUS factor. So for you not to be confused, I want to elaborate more on what antigens and antibody is. So an antigen is a xeno, is a foreign substance that finds its way into the body, or it can be an hereditary protein, yes, which is also the D antigen, that can cause the stimulation of antibodies. It is any substance that can cause the stimulation of antibodies. So what are these antibodies? Antibodies are the immunoglobulins. I don't know if you've heard about the immunoglobulins, which are the cells of the immune system that help fight against bacteria, viruses, hypersensitivity of the immune system and all that. Yes. So whenever I mention antigen, you should know that if an antigen is present, that means there will be stimulation of an antibody. Thank you. If the mother is RHESUS factor negative and the father is RHESUS factor positive, there is 100% chances that the fetus, which is the unborn child, might be RHESUS factor positive. And if the baby is RHESUS factor positive, that means there should be incompatibility. Remember, the positive RHESUS factor means there is proteins on the surface of the red blood cells. And again, remember I told you that anywhere there is an antigen, which is the D antigen, which is the hereditary protein, there will be production or stimulation of antibodies. But the good news here is that the first pregnancy is not affected because this antigen cannot cross and enter the mother's blood due to placenta barriers. These placenta barriers prevent the pregnancy from being affected, but during parturition, which is delivery, there is what we call placenta detachment, and during this placenta detachment, it is possible that the blood of the fetus and the mother might have mixed together, and this causes antibodies to develop within 1 month. So guys, aside the delivery of the first child or parturition, there are other things that can cause what we call sensitization. Sensitization occurs when there is development of antibodies in the body, in the blood of a mother that is RHESUS factor negative or a person that is RHESUS factor negative. Such factors include abortion, miscarriages, blood transfusion, being exposed to needle and all that. So please, if you've ever been exposed to a needle or you've had an abortion or a blood transfusion, please do well to inform your doctor so that you'll be given an injection known as the RHESUS injection. This injection will help prevent antibodies from developing in your body. So guys, if this RHESUS injection is not given to the patient during the second pregnancy, the antibodies that has already developed in the woman's body begin to fight against the fetus. It will pass through the placenta because remember it has already developed, because it will identify an antigen. An antibody fights against antigen. So it will identify the D antigen as a xeno, as a foreign substance, and then it's going to cross, enter the fetus blood and then destroy the red blood cells. This will now lead to the destruction of red blood cells. When this destruction occurs, for the body to compensate the being destroyed, there will be production of red blood cells, not only from the bone marrow where it's supposed to be produced, but also from the spleen and the liver. Then when this occurs, the immature red blood cell will circulate the whole system and then this leads to what we call a disease condition known as erectoblastosis fertilis. It can also lead to anemia, severe anemia. It can lead to hemolytic disease of newborn baby due to the hemolysis of red blood cells. So I told you earlier that you can prevent this. How can you prevent this? Please make sure you inform your doctor whenever you have a sensitization. If you have been exposed to sensitization, I mentioned it earlier, factors that causes sensitization: abortion, miscarriages, blood transfusion, being exposed to needles and all that. Yes, these are the things that can cause sensitization. So please make sure you always inform your doctor. Give your doctor full details about yourself for you to be safe. Thank you guys for watching this video. I know this video has been useful to you. Please don't forget to hit the subscribe button or your notification bell so you'll be notified whenever I upload a video like this. And again, please like, share, and comment. If you have any question, just drop it in the comment section below. Thank you. I love you guys so much.